Treatment of hand, foot and mouth disease. Hand, foot and mouth disease is a common viral infection that affects children may under 10 years old, but can also affect adults. It is most commonly caused by the Coxsackie virus, although other viruses have been known to cause the disease. Symptoms of hand, foot and mouth disease include fever, sore throat, runny nose and mouth ulcers. In addition to these symptoms, red spots may appear on the hands and feet, which are usually accompanied by blisters or sores. Symptoms of hand, foot and mouth disease. Viral infections are among the most common causes of hand, foot and mouth disease, a contagious illness that affects infants and young and older children. Caused by a group of viruses known as enteroviruses, this infection can result in fever, sore throat, mouth sores and a rash on the hands and feet. A rash, fever and sore throat are common symptoms of a viral infection known as hand, foot and mouth disease, HFMD. If your school and childcare is exhibiting these signs, it's important to understand the nature of this illness and what steps you can take for proper treatment. HFMD is a highly contagious virus that affects children under 5 years old, although adults may experience milder forms of the disease. It is typically spread through contact with saliva or mucus, such as sharing utensils or toys with an infected person. Common symptoms include a red rash on the hands and feet that may blister, fever, lethargy, sore throat and loss of appetite. Diagnosis of hand, foot and mouth disease. When it comes to diagnosing hand, foot and mouth disease, a physical exam is typically the first step taken by medical professionals. This includes examining any visible signs of the condition such as small blisters or sores in the mouth, along with any rashes or lesions on the hands, feet, or buttocks. A blood test may also be administered to confirm a diagnosis and to rule out other possible conditions that have similar symptoms. Treatment for hand, foot and mouth disease. Hand, foot and mouth disease, HFMD, is a common medical condition caused by different types of viruses that primarily affects young children. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or acetaminophen, can help ease any fever or pain associated with HFMD. Additionally, topical creams containing calamine lotion may be applied to rashes on the hands and feet to reduce itching and discomfort. Prevention for hand, foot and mouth disease. Our children's health is a top priority these days, and prevention of any contagious illnesses is key. Hand, foot and mouth disease, HFMD, is among the conditions that parents should be aware of in order to properly protect their young children. Vaccines are an important tool in preventing HFMD, although there are currently no vaccines available to prevent this viral infection. It's essential for parents to know what HFMD looks like so they can recognize early warning signs in their children and address them quickly if necessary. Conclusion: get treatment early. The conclusion for hand, foot, and mouth disease that affects treatment is that early diagnosis and intervention are key. It's important to take action as soon as possible when symptoms develop in order to reduce the severity of the illness and prevent complications. Early diagnosis can also help prevent the spread of hand, foot, and mouth disease as a viral to others.